Today on Substance Stories, we'll be giving you a brief crash course into schema therapy. Nathan, today we're going to talk about a particular passion of yours. I know a bit of your PhD sort of covers this. Tell us about schema therapy.
Thank you, Richard. So let's talk a bit about what it is and some of the key concepts in schema therapy. So schema therapy really started to work with a certain cohort of people that kind of had these long-term patterns that were identified as unhelpful ways of viewing themselves and their self-image and relating to other people, so causing issues in their interpersonal relationships, right? And kind of these patterns are quite lifelong, starting from an early age and persisting through different stages of life. Um, so, yeah, that's why this therapy was made. And what the kind of founder Jeff Young found was these certain people that had these long-term kind of challenges often had certain types of, core emotional needs that weren't met growing up, right? Things like secure attachment, having a sense of autonomy and competence, forming that identity around that. Um, having some attunement, so having their emotions validated and heard, being able to kind of play as well, have spontaneity in their lives, but also having, limits set when needed. So people that, parents that weren't too permission giving, but also, weren't being negligent, they're able to set limits when needed, but they weren't punitive with that, right? Uh,
A therapeutic no, as you and I have talked about.
Yes. So when these kind of needs weren't met in childhood, so the model was really proposed that we form these things called maladaptive schemas, which a schema really is a fancy word of it's a mental representation, a mental network in our mind, and it has kind of a core belief. So if I have a schema of abandonment, I have this kind of core belief of people leave me when it's activated. I might have a physical sensation of this tenseness in my body. I might have this kind of memory as well of people abandoning me in the past. And I might have this emotion of kind of fear. Yeah, when this schema is activated. And we kind of say, let's say a child, for example, growing up, might have had someone they were close to kind of leave, maybe a parent they were really close to. They might feel like, people leave, this is what happens. And then they go to school and um, to cope with this, they might start avoiding relationships. That's what we call a schema coping style. We have avoidance. So they might avoid making relationships at school so they don't get hurt, get abandoned again. Or they might.
I think I think what's in it, sorry, I think what's important about schemas is that they're happening subconsciously. So I often use the metaphor of when I ride a bike. I learned how to ride a bike when I was like 5. Now I don't think about it. I just ride my bike. So if we think about the way we interact with the world, relationships, people, as something we learnt and it entered our subconscious. We probably learnt over the first 5, 6 years of our life. And then it's planted there. And that way we interact with the world is a schema in schema therapy's parlance at least.
Yeah, exactly. That's
So
exactly right.
go
And
on.
that's the thing. And we say that they kind of get, they lay dormant until some type of need isn't met in our environment. Then they get kind of resurfaced, right? So there's 3 main ways of dealing. We call it schema, like coping styles. So there's, like I said, avoidance. So for example, with this person that was abandoned, they might avoid getting into relationships so they don't have that activation again because it's really painful when that gets activated, right? So they might have learned that. And it might have been helpful in childhood until it wasn't in adulthood, right? And they feel quite alone and they can't challenge that schema. Or they might have a surrendering coping style, which is acting as if the schema is true. People are going to leave. So if I start feeling when I'm feeling a little bit disconnected in any relationship, like if my partner is super tired from work or if my partner's stressed from work, and I have this kind of schema of abandonment and I feel this lack of attunement in my relationship, I might start, having the schema activated and acting quite clingy. Oh, you're going to leave. What have I done wrong? When really my partner's just having a tough time. And what does that enable? Like, what does that do eventually? It pushes my partner away to the point where she does leave and abandon me. So it's kind of self-perpetuating is what we kind of say these schemas are. They keep perpetuating themselves. And the other one is overcompensating, right? So we might overcompensate. If I think people are going to abandon me, well, if I have any kind of glimpse of a person not attuning to me, I will abandon them before they can abandon me. So I can maintain self-esteem. But really what that does is it maintains a schema that if I don't abandon others, people will abandon me, right?
Mm.
And so these are the three kind of main coping styles of schemas, and there's 18 core schemas that have been identified. There's now been kind of proposed that there's 20. We won't go down all of that, but they all come down to when these needs are met in childhood. So we have things like I said, abandonment schemas, or a, a, um, a self-sacrifice schema, which a lot of kind of therapists have. You know, this kind of putting yourself second because it's the right thing to do to look after others. Or you might have
Mm.
other things like social isolation. We feel like we're quite different to others, or defectiveness. That's kind of something is wrong with me. I am defective and I'm full of shame, and something is inherently, wrong with my self concept. And, that might have been, might have happened in childhood because people didn't show you the care you deserved, and you made a bit of a negative self image. And to deal with that in adulthood, a range of different coping styles can happen. And these are definitely some common ones we see with addiction.
Yeah, and I guess, and there can be positive schemas as well, right? There can be mature schemas that we can have from it. And I guess to me, what schema is a sort of way of manualizing what sort of a more sort of psychodynamic therapy does. So that trying to understand what attachment in our child and what we've got from our childhood, put that into words so we can notice it
Yeah,
more.
and we give it these little
Is that a reasonable
yeah.
summation?
Yeah, we give them these little names, this is just the easy way to operationalize it, right? Um, and what I find really helpful and I really like about schema therapy is it's not diagnostic. Like, it's a way of understanding psychological concepts of viewing ourselves, relating to others,
Mm,
relating to the world, without having to put labels on, you know, you have borderline personality disorder or you have narcissistic personality disorder. Even though schema therapy was actually really formed to work with personality disorders, it's really more around
mm,
looking at these underpinning psychological concepts that play out, that leads to these issues in the way they view themselves and relate to other people, rather than putting a label on it. And what I like about it is it's common to all human beings. We all have schemas. We all have unhelpful schemas. We all have positive schemas. And you know, that's why it's really important for a therapist working in this place, I think, as well, in this space, to also do their own work on their schemas. Um,
absolutely. I think that's a common therapy mistake. Just because we know about them doesn't mean we don't have them, right? We all have the same defense mechanisms. We're all, in my experience, psychiatrists and psychologists, perhaps a bit less mentally healthy than the average person, Nathan.
I definitely have a lot more maladaptive schemas than the average person, I'd say. Which,
So, how does this tie into addiction?
so, what I think is really important to consider is, how does the addiction really interact with the schemas? And that's really individualized. And I'll get on to how it will lead into the coping modes first and how it might be perpetuating.
Sure. Yeah.
But then I'll also talk a bit about the mode concept as well, because we have certain modes, which are kind of another words for parts, different parts of us that I can set, like, we've talked about their like kind of addictive modes. So we'll talk about that in a moment. But first, let's just say a person, for example, has a defectiveness schema. They go through the world with these glasses. We can look at schemas as well as a way of, it's kind of like glasses where we kind of look into the world and also look into the mirror, right? So if I think I'm defective, um, you know, I might set the bar pretty low for myself. I might kind of shortchange myself from achieving anything that I really want to do in the world. Um, and let's say I find substances, I might use substances as a way to avoid the pain of that, to self-soothe. Um, at the
Mm,
same
mm,
time, let's say I have a defectiveness schema and I have a chronic addiction now because I've been using to kind of avoid feeling the pain. And I get to a point where I want something different in my life, but I have this chronic drug addiction. That's going to limit
mm,
my ability to actually function in the world, right? But because I'm not actually achieving things, not because I'm defective, more because I have this chronic addiction, I'll be
mm,
surrendering to this schema. I won't be attributing it to the substances. I'll be attributing it to my self concept that I'm a defective person. Um, so I think
mm,
part of the work in
mm,
schema is actually trying to get people to understand how their views of themselves and how they relate to other people causing these issues. And if addiction is part of the picture, separating the two. Often let's say other substances, let's say I have an addiction, sorry, let's say I have a defectiveness schema, um, I might use some stimulants to overcompensate because when I use stimulants, I'm not full of
mm,
shame. I'm actually full of, I feel really strong. I feel really confident. You know, I've had a bit of
mm,
cocaine. I walk in and I'm the man in the room. You know what I mean? I don't feel defective.
mm,
So
mm,
almost substances
mm.
themselves can be a way of overcompensating for a schema.
Absolutely. But but in that same way, as you say, also it not only is it like I think well, like we talk about addiction all the time, not only is it a temporary cure, but it is guaranteeing that we continue to enact this schema. You know, if I will feel I am defective because I am stuck in an addictive pattern, that to me is more evidence of my defectiveness.
Correct. And another way of that's exactly right. And another way is if I have a defectiveness schema, then I overcompensate by using cocaine. Then when I come down, I feel really flat. So I'm like, oh, I'm back to my defective self. Really, you're just coming down. And then you form this belief
Mm,
of I'm only not defective if I'm using cocaine, right? So then
mm,
that
mm,
need to kind of overcompensate that schema keeps it going. So part of the work is really trying to separate the two and separate who am I as a person versus what is the addiction actually bringing to the table for me and the issues in my life, you know, and being able to see how the
mm.
substances kind of are coming into the coping styles. Um, yeah.
So you were gonna talk about the mode. So the angry child, I'm
Yeah,
guessing.
so what the kind of, Jeffrey Young and his team found was if we're working with certain people that have a lot of schemas, it's quite hard to think where do we start? So, they
Mm,
brought this kind of concept of, the modes. So modes are just like different parts of us, for example, I often talk about this in the detox that I work in and at the hospital, like when people really want to leave the service, it's like, yeah, part of you probably does really want to run, but a part of you is actually trying to stay here. Like we have these different parts that come out at different
mm,
times. We're not just it's not just one whole thing, we often flip between different sides of ourselves, Um, yeah.
mm,
And like so the mode model is really speaks about at the core of it are these child modes, which are like it's pretty much another way of saying these emotional states, So a
mm,
schema mode is really a current psychological state. So when a schema is activated, let's say I have an abandonment schema activated, then it will bring up this certain mode, this part of me. So the child modes are kind of emotional states. I'll be thinking quite vulnerable. Let's say like they say the vulnerable child's at the core of it. So I feel abandoned. I feel really vulnerable. I go back to this self state of like a vulnerable child, like a helpless child. It's like that inner child work they talk about.
mm,
Um, and that's really painful. So to deal with that vulnerability, um, I'll often use some type of coping modes. And you'll often use the coping
mm,
modes that helped you in childhood get through those tough times when you felt like a vulnerable child, right? So for example, let's say I grew up in a house where parents were always fighting. As a child, you probably don't have the mental resources to just listen to that because you would get really overwhelmed and burnt out, and it'd
mm,
be really dangerous to do that, as a child. So you might have
mm,
learned to dissociate
mm,
almost. So we call this part, it's kind
mm,
of like a flight mode. If you think about the fight, flight, freeze, you can break down the coping modes into those. So the flight is almost this, we call it the detached protector. This part of you might come in to shut off from your emotions because feeling vulnerable is painful. So whenever you feel this emotional challenge
mm,
in the future where you feel vulnerable due to a schema being activated, you learn to shut off from your emotions and you go numb, right?
mm,
So that's a kind of a flight mode. And another flight mode is what we call the detached self-soother, which is a part of you that wants to detach from the pain of your emotional schema coming up when you feel vulnerable. So you might
mm,
use substances to self-soothe. You might scroll to self-soothe. You might eat food to
mm,
self-soothe. Um, right? It's just these current states of psychological states linked in with the behavioral patterns that you use to cope with these issues.
mm.
Um, some of the fights.
One of the things, Nathan, so one of the things I think that sometimes puts people off, sometimes puts me off schema, is for a psychotherapy, it's very, it's got a lot of nomenclature, right? It's so, I would imagine listening to this, it's so easy to vague out and be like, oh, all these words, all these different things. how do you respond to that?
Excellent. Good point. Because when I first learned about Schema, I'm like, this model is awesome. Like, I really love how it works with people. But there's so much jargon that I feel overwhelmed as a therapist listening to it.
Mm,
If I was a patient going through addiction, I'd be like, what the hell is going on? So you make it really simple. You
mm,
don't use all these fancy words. You just talk about past. So like, there's a part of you that might come up that feels vulnerable. And to deal with that,
mm,
what do? You know, you talk a bit about that. Oh, so it sounds like a part of you comes to kind of protect yourself. And we get them to actually name these parts, you know? So like a
mm,
vulnerable child, I won't call it, especially if I'm working with a person in like a forensic setting or it's coming to me on bail with, you know, a probably doesn't have his kind of this vulnerability at first. So you call them like, you know, the vulnerable, you get them to name it, or it's called the little self, you know, like when you kind of felt little and you felt kind of, like when you felt vulnerable as a child, is there a
mm,
name you put to that? Or the part of you that comes to make you detach from your feeling, what would you say, call that? Uh,
mm,
so we get them to kind of name it instead of giving them these kind of,
mm.
giving them all these names of these modes.
Yeah,
If that makes sense. Yeah.
absolutely. My other question, Nathan, is I'm listening to this, let's say I'm in, I want to do schema. Does it work? Does it have a good evidence
Yeah, so
base?
look, it definitely does for a lot of different kind of clinical issues. So, like I said, it was originally really made for personality issues like personality dysfunction and personality disorders, and there's a strong evidence base for that. Um, through working with those modes, to work with those modes, we do things that are very experiential because it was actually came about because a lot of people said, I'm sure you've heard this before, Rich, that even though I think different, I don't feel any different. So these people that don't respond to like normal
Mm,
CBT, cognitive behavioral therapy, it's like I'm challenging that I'm actually not effective because I'm listening to this, but I don't feel any.
mm,
So what they notice is there actually needs to be something emotional. There needs to be these corrective emotional experiences through emotional interventions to feel different. So what
mm,
actually I think works really well in schema therapy that separates it from others and leads to good outcomes is things like chair work. So we put different parts of people in a chair. So we might another kind of mode we talk about is like the punitive critic mode or the punitive or the demanding critic, which are like the inner critics. So we get them on a chair and we get the
mm,
person to talk to that part of them and then jump back to that chair, then talk back to the vulnerable part of them. And they actually get that really intense emotional experience of how they treat themselves and learning to talk back to that in another chair as a healthy adult. So then they can use that in their own life. Those type of interventions, I think, is what really leads to good outcomes for long-term issues. The other thing, what I know from the evidence base as well, some other kind of clinical issues that it is useful for with the evidence base is as well things like eating disorders, which are kind of quite chronic, and also chronic depression. And there's been some new
mm,
evidence as well in the forensic setting for people that have like antisociality or violent offending that
mm,
this kind of model can be quite helpful as well, talking to different parts and getting people to notice when needs aren't kind of met, how these
mm,
overcompensator modes come out. Um, and it's really because you're trying to meet a need. A need in your life is not being met, and you've learned this behavior, this way of living, because it's kept you safe. But now here, all these issues are
mm.
locked up. So what can we do to to help you move forward? Um, you know,
Yeah.
um, so there's starting to be a big evidence base for that. And for addiction, there is definitely some evidence around that. There definitely has been around, some people that you could just work with the addiction. Um, you leave these personality vulnerabilities not considered, and people
Mm,
kind of keep relapsing. Because for a lot of people that we work with,
yeah.
their addictions are due to relational issues. People.
Mm. Yeah.
Yeah,
As we talk about a lot on this show, addiction is a cause and a symptom, right? And if you don't address the underlying cause to the addiction, what addiction is a symptom of, then you won't achieve a lasting
that's
recovery,
why I think
right?
schema is good for
Because
addiction.
you'll still feel
Yes,
miserable.
exactly right, Rich.
Yep.
Because this gives you an explanation around key concepts that are core to all human beings to understand how they work psychologically and what are the roots of my addiction. And um, there have been certain proposed, I suppose, interventions that are schema focused around addiction. So there's a thing called the like triple mode cycle where it's kind of like um, there's this vulnerable part of you comes up. Um, to deal with the vulnerability, you'll you lead into some addictive mode, such as like, a detached self-soother mode or maybe an overcompensated mode. Um, and they'll fuel the drug use. For example, you might start trying to big know yourself. And, part of that is kind of, I feel really powerful when I use substances. So you might start taking cocaine to kind of fuel your ego because it makes you feel powerful. But then that leads to this kind of part of you that starts judging yourself, saying, I'm an idiot, I've used again, I've relapsed, what's wrong with me? That makes you feel vulnerable because you're vulnerable, you use again, and you're stuck in this kind of cycle of
Yeah.
vulnerability, overcompensating, or detaching, and then judging yourself and being really punitive with yourself for doing that. And you're stuck in this cycle. And um, to deal with the vulnerability of this whole thing going on, there's all these justifications and rationalizations to keep the addiction going and fueling. So what I see our part as a therapist in that kind of space working with schemas is getting people to be researchers in their own lives. I really want a person to become a researcher in their own life
Mm.
and
Uh,
when these kind of things are going on for them and really noticing what core
mm,
needs in their life aren't being met that they feel like they need to go back to using. And really externalizing those type of voices in their heads, those kind of critic modes, as something they've learned to probably absorb someone else's voice growing up, whether it was a parent or a bully or a teacher, and to separate that from their
yeah.
own self concept.
Uh, couldn't agree with more. And that's what I think. Um, yeah, can be so exciting about recovery. And what I talked about to people about a lot is that we have this. We're with our brain again. We've left our brain. We've abandoned it for substance use. When we get sober again, that's our opportunity to learn about ourselves, reacquaint ourselves with our brain and our mind, work out what's driving us. It can be this incredibly exciting, hard but exciting opportunity. So I think, in a quick conclusion, so schema, unlike other sort of cognitive behavioral therapies, doesn't just focus on the top downy, you're feeling these feelings, this is how to not feel them, but it also is not purely bottom up. It doesn't just focus on these are the feelings, these are why. It sort of is a mixture between the two, well integrated. It's a great therapy. It's got a great evidence base. It's pretty widely practiced, which is really good. So it's pretty available. Really recommend it if hopefully this podcast made you curious about it. Recommend you go talk to a schema therapist and give it a try. Thanks so much for joining me, Nathan.
Perfect.